it's done. Hey, I'm Dr. Ruth Roberts, the original holistic pet health coach, and with me today is Jenny, who is a licensed veterinary technician and has had an incredibly interesting career path. Jenny, please welcome. And Facebook is unhappy with something, but that's okay. I think it's going to the right place, to the group. Welcome today. Thanks for joining. So tell me, why did you want to be a veterinary technician? Where did that all start?
I wanted to be a vet growing up as a little girl, as a lot of us do. And once it became time to go to college, I started looking at vet school prices, and it just wasn't something I could do astronomical as. And I was literally just laying in bed one day watching the Animal Planet, watching all the animal rescue shows that I love, and a commercial came on for become a vet tech. And I didn't know that was even a thing. And I was like, okay, there's nurses in human medicine, so why wouldn't we have an equivalent in vet med? So I looked it up and I was like, I can do this. I could swing this. And I was 23 at the time. I already went to conventional college for photography. And I was like, I wanted to do something more with my life. And I got into it originally to rescue animals. And I enrolled in vet tech school. And at the same time, I quit my job I was already at for almost a decade, running a swimming pool, and started working at the Humane Society. And while I was in vet tech school, I was working in a shelter and to get that hands-on experience. And that's how it all began, from just a silly little commercial.
It's crazy how that reaches sometimes, and that's really interesting. And so you went through the vet tech program. And the other thing I failed to mention is that Jenny's also been through the holistic pet health coaching program, and we'll get to that in a minute. But so you went to the vet tech program, and what happened when you got out in practice and started working in a vet clinic?
It was completely different from shelter med, number one. And I did my internship. I got hired on to where I did my internship, and it wasn't vibing for me. I don't know why. Maybe I lost a little bit of the passion because I wasn't in shelter med anymore and saving lives and finding homes for babies. And so in the hours vet techs, we literally could work 24 hours a day if they would let us or make us. And it wasn't for me. And I really like the science part of medicine. And so I started working for Antech Diagnostics, and I did all the urinalysis and CBC and chems and fecals and things like that for my region, which is St. Louis. And I loved it. Unfortunately, vet techs don't get paid a lot, and it was a higher pay than working at clinics back then. I think even working at McDonald's, you could have made more at that time, 10 years ago. And I also wanted a steady schedule, just the good old 8 to 4, Monday through Friday, and you don't get that at a clinic. And so that's where I posted up for another decade. And while I loved it, the first half, I started to realize that there was more that I could be doing. It was pulling at my heartstrings again, that I was just working in a lab. And while I was making an impact, helping doctors help diagnose animals, it wasn't for me. And my strange story into the holistic side is that COVID hit, and I have psoriasis and psoriatic arthritis, and I was on those great injections that compromise your immune system, that can make you sicker, cause lymphoma. And I've been on that for years. And with the pandemic, I was like, I don't want to die because I don't want splotchy skin. I'm taking myself off these and let's see what happens. So I did, and of course my psoriasis started to flare, my joints started to hurt, and so I started researching what else can I do, home remedies for psoriasis, and I came across CBD. I was like, okay, so I read the science because that's what I wanted to do. It makes sense because psoriasis is an inflammatory disease. CBD is great at controlling inflammation, and I went from there, and I was able to control my psoriasis within 6 months with just CBD. And this is something I've had literally since I was 8 years old. So it was insane.
It ain't supposed to work like that. Is that right?
Right. And I'm supposed to just take these injections that are going to possibly give me cancer in the long run and die from a pandemic. But here we found this natural medicine that obviously my dermatologists weren't talking about, because nobody wants you to know about the wonders of the first medicine. And then the heartstrings were pulling again. I wasn't happy at the lab anymore. So I started looking for jobs, and I was literally, it came up CBD dog health, looking for a veterinarian technician. I was like, CBD for dogs? But then in the back of my brain, I'm going, but they told us in vet tech school that THC is poisonous to dogs. That's a whole nother story I could go on and on about. And I was like, what? So I started researching about CBD for dogs and all these things that I was using currently in my life. I was like, why am I not using this for my dogs? And I went down the rabbit hole, applied for the job, and 2.5 years later, here I am.
That is just so crazy. But that's exactly the experience. You have to start doing research to take care of yourself because there ain't very many people of us out there doing it solely to help others. But that's amazing. And I suspect that the injections that you're on, maybe they were Janus kinase inhibitors, oh, Cytopoint, maybe?
Yeah, kind of. Let's see. We're going to shut down something so we're not itchy and inflamed, or we could use something natural. So, yep, exactly. They're that class of biological drug.
Right on. So for those of you that have used CBD Dog Health's products, so whether that's the Calm, Ease, Heal, or the astonishingly amazing MycoDog products, and you've called in for Technosport or you've emailed, you've probably spoken or read an email from Jenny. And so when we were getting this program together, Jenny wants to do this so bad. I'm like, okay, cool. It'll be a really good test to see what level of quality this material is. I think it's good, but that's me. I was so happy to have your eyes on the material and to go through it. And I think the thing you weren't familiar with probably was the Chinese medicine part of it.
And it just brought a whole new tools to my toolbox to help people. It was insane. I can't begin to tell you how valuable your class is. This is one of 4 binders. This is your entire class.
Holy
There's
smokes.
4 of them. The knowledge that you gain from taking your course is it's amazing. I've been personally trained by Angela Arlino in cannabis and mushrooms, and it just gave me a whole new war bag of things when I'm talking to people. And then of course they say, what else can I do? First and foremost, I'm going to say, what are you feeding? Because if you're not making your dog's food, let's just start there. And then if you are making it, let's start adding in some Chinese herbs and pressure and things like that. And you just open up a whole new world. It was so valuable from even me been through the conventional vet tech schooling and then being trained for was about a year and a half at that point by Angela Arnolino. And then with you, I feel like I could take on the world, if needed to, with holistic medicine. Your class it's invaluable in my opinion.
Cool. I'm so glad to hear it. And that's the thing is that what y'all are doing at CBD Dog Health is just crazy because there are so many CBD companies out there, both on the human side and the pet side, and so many of them have, we'll say, inferior products. How about that? So products that either don't work or they're not extracted cleanly, but that's what I love about your stuff is that it is straight up essentially an essential oil of the hemp plant, which is just amazing stuff. So right on. So what I'm going to do is see if I'm smart enough to share screen and jump over to our group. This has been astonishing to me. Here is this group of gorgeous coaches that showed up. Somehow you didn't get in that picture. I'm not sure what happened, but we got to actually meet up in San Diego. But this is the thing that's nuts. Since August, this group has grown to 28,000 people, which is just incredible. But what that tells me is that there's a lot of problems out there. So let's go through a couple of questions. And so here's a doll baby who is very perplexed, but this person has got an 18-month-old Labradorish looking dog that's got issues holding her bladder. And when she sleeps, she pees. It started as little spots and now it's puddles. So it's not a urinary tract infection. They think she might have a kidney disease, but they want to put her on Proin for incontinence. Not my favorite first step to go to
No,
Pro-In. And how'd that work out?
she died of osteosarcoma. I'm not saying the two are related, but I took her off the last 2 years of her life once I learned better. Incontinence is a
Right.
tricky one just because there sometimes conventional drugs can help and sometimes Eastern. You really have to combine the two and see what works best for your pet. As soon as I hear kidney issues, I love recommending CBD Dog Health Ease tincture. CBD is going to help because we're finding that the kidney is rich in CB1 and CB2 receptors, which are the receptors that interact with CBD, but then also the frankincense and turmeric. And you have turmeric to additionally help combat that inflammation. So when I see blood in the urine, there's definitely some sort of inflammatory issue going on that's causing these kidneys to freak out and produce blood in the urine. But then you have the frankincense, which is going to help support the immune system. It's all about supporting the immune system. And then, of course, obviously, what are you feeding your dog? If you're not putting the dog's food in a crock pot, it's not worth it. Every Sunday, I rotate beef, chicken, pork, lamb, all these things that my dogs love. And I rotate all the brassica veggies that you tell us and then add your supplements in. And my wife will come home and she's, oh, what's for dinner? And I'm like, yeah, that's dog food. Sorry.
Sorry. You can have some. Yeah. Right on. And another really key thing here is they're worried about her kidneys, but they're going to start her on Pro-In. And what I would say to that is don't, because if it is a kidney infection, what that's going to do is make it difficult for her to pass urine, because the way Pro-In works is by tightening up the sphincter. And if she's got an infection in the kidney, she needs to keep peeing or some problem with the kidneys. My guess is that this pup was spayed somewhere between 4 and 8 months of age, and basically she's probably got like a hormone responsive urinary incontinence. So we've had great success by shifting diet, so crock-pot diet, adding in CBD, because again, we're going to get everything to start functioning on a more normal level. And then using things like there's some bladder support, so yucca sagrada and several other supplements you can try. But I think it's really critical to get the kidney component nailed down first before you do anything else. And then if you need something to help support the control of the bladder, that's where, honestly, if you're going to go with a prescription, an estrogen product is a much better option, because then we're going to actually combat something I'm calling spay-neuter syndrome. Because what happens with pets that are spayed and neutered early in life is they end up developing levels of, come here, Hio. She has to help. Oh, yes. She says she had her supper. She's happy. But at any rate, they end up developing levels of luteinizing hormone that are 20 to 30 times normal, and tissues that shouldn't have receptors for them do. And that can be in the kidneys, the bladder, et cetera, et cetera, et cetera. So keep doing a deep dive, keep breathing, start feeding some real food if you're not, and wait on the Pro-In until you get some more information. But what a cutie pie.
Yes, and the best part about your program is it really breaks it down in the systems of the body. You have a whole section on renal health. You have specific recipes for kidney issues in the crock-pot diet. So you've like really nailed it down to where someone, and I love this community, and these communities have grown fivefold in the past year. And this is a great place for people to go and ask these questions. But you have these resources readily available and just broken down so beautifully in your class, whether you want to become the holistic pet health coach or you have your separate courses as well. When you go, I don't want to take the whole thing, but I want to just take the kidney support, and boom. And you would, all the questions are, so all the answers are in that course.
Right on. And that's the thing too. You all have a huge group for CBD dog health, and you've got subgroups broken out by specific conditions. And I think you all are doing a fantastic job there. Again, if you're looking for help along these lines, if you're not getting it here, and gosh knows the other coaches are jumping in here, as well as the group on Circle, which is a little more private, where we're a little more liberty to say things that doesn't get those that are unhappy. That's another great option. Denamarin into a cat. I cannot imagine a more difficult prospect.
I couldn't imagine trying to pill my cat. 2 times a day, or do they have a 1 time a day pill now?
I think it's whatever you can do sort of stuff. And you
Like,
have to give it on an empty stomach too. So that's the other
right.
issue with Denamirine.
Then, yeah, so we can't even hide the awful taste of it. Yeah. You're looking for a liver supplement. Milk thistle. You can break those capsules right open and just sprinkle it. It doesn't really have a taste, at least that I have noticed. Of course, all of us, we taste our dog supplements just to see, because we can.
Just to make sure.
But milk thistle, boom. It's the best one.
It is. And it's astonishing to me the number of people that would come into my practice and the dog had been on Denamirine for 2 years, zero change. They go on milk thistle for 6 months, boom, problem solved. Now, if you've got a kitty that is just like not having it, like not taking any oral supplements in, this is another really cool thing about CBD products is that you can use them topically if you have to. So our cat Pepe, when he really wasn't feeling well, he would permit us to apply a little bit on the inside of the ear. And when he felt good again, he's, nope, that's over. I'm good for now. That's another really good strategy. And I'm not sure what's been your experience as far as supporting pets with liver challenges with CBD? Have you
Oh,
seen good results or?
I have, and one of the misconceptions of CBD is you give it long term and it's going to cause liver issues. That is false. There's been a research study out there, and when I say research study, I don't mean something like that we've done and put together ourselves. No, like clinical research showing that CBD causes the reparative effects to the liver. But yes, those liver enzymes will raise when the CBD is processing through the liver, but it's called a functional rise. And then they go back down after the CBD has been processed full through. And instead of continuously giving Denamirine or any other drug that's going to continuously harm the liver, you have something natural that's going to actually repair. And yes, it's going to raise for a minute and then it's going to go back down. I have, one of my clients, they called me very upset saying that they took their dog in and their dog's ALT was higher than normal. And I said, okay. I said, did you happen to give CBD beforehand? The blood draw, they're like, yeah. And I'm like, that's the problem. You just saw the functional rise. It's one little downfall, but when you're trying to get blood work, you want to withhold everything for 12 hours, no matter what it is, when you need that exact baseline. Now, I tell my people if they need CBD for the car ride to go to the vet and they're not having a blood draw, go ahead and give it. But if you want to see those exact appropriate numbers, you need to withhold everything, including food, for about 12 hours. That's just the general fasting rule.
Right on. Right on. It's astonishing that we forget that. Yeah. Tough stuff. Susan's little 13-year-old Havanese Maggie, and eyes are constant. So Susan, if this is something that's totally brand new and you didn't say why she might be blind, but this honestly is a situation where I would get your vet to check it out and in specific to make sure there's not an issue with glaucoma, because even with some lens changes in the eyes that can create increased pressure within the eye, which can create a lot of pain and eye watering as well. And then also to make sure that there's no blocked tear ducts. So my go-to, which used to be Similsan eye drops, unfortunately have been taken off the market in the US because the FDA has decided that homeopathic products are no longer welcome. So we're looking around for some other ones. There's a couple that are available on some other sites, but if you find everything else is good, this has been a great resource for many dogs. The other big thing too is to make sure she's not got corneal ulcers or something like this, because she's unfortunately one of those breeds that has a pushed forward. They tend to get in trouble. So make sure it's not scary stuff. And then from there, go with symptomatic treatment if it is allergies. Again, CBD is an awesome option. I think this, and then quercetin can be super helpful. And what else would you throw in? Which of the products would you use? Heal or Ease or?
I would say Ease Extra Strength, just because it's an older dog, and as dogs age, their endocannabinoid system weakens, just like every other system in the body. Buddy about 10 and up, I like to do the extra strength if they're experiencing an allergy issue. I just really love ease for allergies because of the added frankincense and turmeric. Angela did a great job of formulating because when you have allergies, there's an immune system deficiency somewhere. So the frankincense is in there to boost the immune system and the gut, and 70% of the immune system lives in the gut. And then the turmeric, we're going to fight inflammation with the CBD and the turmeric. Yeah, I would throw in some mushrooms too, just because they're older. We want to, keep supporting that immune system. Vitality is a great one. It has 7 different mushrooms in it with 2 other adaptogens that really all complement each other. And yeah, just when I see the eyes are involved, my first thing is let's go to the vet first to make sure we're not dealing with a high IOP or anything like that. Eyes are important.
Right on. And even if they're blind, they can still have really uncomfortable problems and problems that can turn into big issues. So we want to make sure that intraocular pressure is normal, because too high indicates probably glaucoma, too low can indicate inflammation, whether that's infection or an autoimmune issue. So right on, Jenny. And I think the idea about using vitality is a great one too, because something is not right for this young lady in terms of immune function. So we want to give her as many options as possible to help balance things out.
I love that you brought up
Yuck.
quercetin. One of the best things that I've ever learned from you. I used to be one of those people that I take ibuprofen and Benadryl when I didn't feel good. My allergies were acting up, and it was probably, I've learned so much in your class. But instead of taking Benadryl now, I take quercetin. Instead of taking ibuprofen, I take a turmeric pill and some CBD. They literally do the same thing as far as when you look at the medicine. I love quercetin now. It's literally
it, it is absolutely amazing and just crazy good for kidney function, which is strange. Let's see. So that's pretty yucky that you got to see the gross fatty tumor out, but this is a really common problem. So the upside is that these are benign tumors, but they're still tumors. So they're still telling us that something is not right in the way the immune system is responding and tracking down cells that are not normal. Misty, I'm not sure where you are in terms of starting down this venture, but food's always going to be my number one place to start. If you're feeding a kibble diet, definitely I would recommend going with home cooked food, especially with these older dogs, because that's going to be easier for their guts to handle. And then we're going to really look at supporting the immune system so that it's surveilling appropriately and eating the tumor cells. So myriad of ways to do that. We've talked about vitality. We've talked about heal and ease. And I think ease probably would be a great one to go with, because it helps in Chinese medicine, helps to resolve stagnation. In Chinese medicine, this would be a phlegm nodule or phlegm stagnation. So we're going to get the goo moving. And there's a couple of other ones. But again, if you've got some other health concerns going on there, this is where working with a holistic pet health coach would be a great idea, because they can listen to the whole list of issues and help you create a plan that's going to really be the best option for Misty, and then help you modify it if you hit some road bumps, that kind of stuff. And I'm sorry, you're Misty, but I don't see your dog's name, so apologies. But yeah, Janet, your Labradoodle's covered in those.
I get those all the
Wow.
time. Unfortunately, you can apply a topical CBD because a lot of times with those lipomas, there might be some unhealthy cells that CBD can recognize. But again, because they're mainly composed of fat cells, it might be harder for CBD to target. But that's what I learned. That is a stagnation tumor. That's what I learned from you. And just cleaner eating and get everything flowing properly.
Right on. And that's the thing that's really interesting too, that she's a little on the heavy side. And so I think getting on a whole foods diet will help her drop weight. And then you're actually going to see those lipomas shrink a little bit, which is super cool. Mm-hmm. So that's always an option. Let's see. Now that's pretty weird. A puppy that got a rabies vaccine who's got like zoomies. That's pretty unusual. And then Paris jumped in here, one of our coaches, and talked about using thuja, which is one of the things I recommend for preventing reactions with vaccines. And so you can use this in this mother tincture. You can also use it in, didn't mean to go there, into a homeopathic version. But then the vaccine happened and you're getting stuff, then you want to use it really for about 21 days. So have you ever heard of that? In the limited
That's
time in practice that's pretty bizarre. Yeah.
definitely
But
not
it
hyped
sounds like,
up. No.
yeah. Yeah, the neurologic system definitely got overstimulated. So I think that's something you're going to want to do for probably 21 days.
Yep. My wife and I, we adopted a puppy in July, and right when we adopted the puppy, I ordered 3 bottles of Thuja just to, because I did want to do some of the vaccines, so get the antibodies, but he was on Thuja until I think October, just to get everything nice and detoxed. And of course, he had kennel cough when we brought him home, and I think I emailed you and Angela, and I was like, what can I do? Of course, like I know, but what else can I add in? So we did freeze and ease, and then you suggested the Amber Naturals, their kennel cough formula. And then of course my other dog got it. I was like, all right, everyone's just going on quercetin and a whole shitload of CBD, and we're gonna get through this. We're not doing antibiotics, and within less than a month, everyone was clear-eyed, clear noses, and not coughing up the crap all the time. So it was,
Yeah. And that's the crazy thing too, that whatever that respiratory complex stuff is going around and that's starting to really spread. It's just nuts out there. It was crazy. I was looking at news headlines, and so the one I was looking at was the incidence of respiratory disease in humans is off the chart right now. And then the next headline is the incidence of respiratory disease in dogs is starting to get off the chart too. I think this is where, of course, most of my colleagues, conventional colleagues, are like, get your vaccines, get your kennel cough, get your this and that and the other. And maybe, yeah, maybe it would prevent it from being as bad, but I doubt it. So I think then we're stuck with just being cautious. Like the few times I've flown recently without a mask, I got sick as a dog, and I just don't want to do it. It's not worth losing 2 weeks, and it's not worth listening to your baby cough for 2 weeks. So I would limit your exposure. Maybe we need dog pods now until this thing blows over. I don't know, but that's, I think, going to be really critical, especially for dogs that may be immunocompromised, for pets that have cancer, that kind of stuff. Definitely limit exposure. Hang out with dogs that have similar, like they all just hang out in your neighborhood, and that's pretty much it. Nobody's going to a boarding kennel, that kind of stuff. And then support immune health.
What did they call it back in the pandemic? Your social circle?
Yeah, I heard folks calling it pods when we were down in Mexico. They're like, no, this is our pod, man. You can't, sorry. I don't want to risk anybody getting infected. So there you go, your dog's social circle, super critical. So I think there's that. And then the other thing is just preventing or supporting the immune system from getting sort of overtaxed. And again, we're going to list really the similar things. So vitality is going to be critical, CBD is going to be critical, and then using things like immune support from standard process, making sure that the gut health is up to snuff, because as Jenny mentioned earlier, something like 75% of our immune system resides in our gut, or at least the molecules are made there. So that's just going to be super critical, is to keep your dog healthy, limit its exposure, and support immune function.
When I started seeing reports of this, I went straight to my binder, to the respiratory section, looked at the things I didn't have, and then went straight to your website and bought the things I didn't. Now my dogs, they're on PneumoCare by Amber Naturals, on pretty much anything that you had in your respiratory section. I just went ahead and bought to get ahead of the curve. My dogs don't really go out and do a whole lot, but I do have a puppy and a 7-year-old. I want to make sure we don't get sick or anything.
Right on. Oh man, boxers have seemed like they're getting the rotten egg in terms of GI problems, gurgly stomach stuff, 5 to 6 hours. Kathy, that's a tough one. And
The good old
paw
boiled chicken
licking.
rice.
Yeah, right on. So if Olive has been doing this for a long period of time and she's 5, what I would really suggest you do is a Glacier Peak pet sensitivity test to see what's going on in terms of food sensitivities. And then honestly, work with a coach. And Paris Reed, who you may have seen posting in the community here, is a boxer fan, and that's the breed she has. And in fact, she's had the very similar issue with her pups that she's worked through. But that is an adorable, adorable picture. So I think anything you can do to support GI health, figure out what's at the root of the problem, and then again, support more normal function by improving the microbiome. So that may include probiotics. Medicinal mushrooms are crazy, crazy good for gut health because they have incredible fibers in terms of the word is escaping me. The same reason that they're great for cancer. Ah, help me out, Jenny. I've lost the
Are you
word.
talking about the
Um,
chitin?
the chitin, and then there are also the specific fibers that are in like immunity and then PPAs. There we go. It was hard. But at any rate, they're shown to
You caused
help.
me to blank too, but yeah.
But they've been shown to help improve surveillance on the tumor, to reduce tumor growth, and to reduce angiogenesis or new blood vessel growth into the tumors. So they're astonishingly good to improve gut health. So chitin, as you said, that's one of the parts of the cell wall that doesn't break down easily, but it does feed the microbiome. So it's another really huge use for uh, any of the mushroom products. But man, love that picture. She looks adorable,
I know, it looks
but not
professional.
happy. Yeah, right on. Goat milk versus milk powder.
You can't beat the
Do,
real thing. Goat milk is something I haven't really implemented yet. Both my dogs they have a pretty good gut system going. I just I'm not there yet with my dogs, but if I would ever have to choose between the actual whole anything or powder, I would always go with the whole actual product to get all the benefits, because just like with mushrooms, when you grind it down to a powder, you're probably going to lose some of the properties that are actually can help you. Just like with mycodog products, they're actually extracted from the fruiting body, where other powdered mushrooms, they grow on a log and then they just chuck the whole thing into a chipper and then stick it in their little pill packets and they're done. But you don't get any of those medicinal properties that you're taking the product for when it's done like that. But that's just me.
right on. And that's the thing. So what's the point of using the goat milk? Beth, are you trying to use it to help improve gut health? Are you trying to use it because it's a thing? And so I think what you could do is look at many people use it because of the fermentation, so it's easier to digest. And if you feel like your pup's health is in pretty good shape right now, you might look at a local, if you have this available to you, like a local cow's buttermilk or some sort of other cultured product. So you could look at, if your dog is a crazy dog and eats anything that's not nailed down, sauerkraut that is still actively fermenting, not the stuff in the tin. But there's a lot of postbiotic fibers that are available in fermented products, as well as the prebiotic organisms that can help us tremendously. So I would check that out. Hopefully that's helpful, Beth. That's adorable.
Oh, shampoo is becoming a great topic of discussion in our holistic world, because people are discovering when they look at the ingredients on shampoo that it's all artificial and things that could actually be dangerous for the dogs. I love four-leggers. I trust all the ingredients that they put in there. I've tried a couple shampoo bars that I've gotten in swag bags from shows. I couldn't get my dog to sit still long enough to actually get the suds flowing, so I like the liquid easier, but shampoo bars are great as long as you're looking at the ingredients, and by looking at those ingredients, they seem okay. Not too horrible. You're
Yeah,
not
this
getting
looks
20 20-letter long words that you can't pronounce in it. So that's what I always look for. If I can't pronounce it, I'm not going to buy it.
Right on. Yeah, so Amanda, I'd concur. This looks like a pretty decent product. So right on. Oh, yuck. So Mary
Oh,
Ellen, beautiful half boxer, half pet bull.
mm,
And so, yeah, what do you do with this thing? And it does look pretty bloody.
vascular. Yeah.
Yeah, lot of blood vessels going on in there. What you might consider doing if you can, the beautiful thing is from my perspective, this would be relatively easy to remove, but it is not cheap. You're absolutely right. The other thing is that because of where this is, it's wrapping. There we go. Wrapping this thing up just to prevent it from being damaged. And then have you seen, this is huge, so this may take a while, but have you seen something like Remedy be really useful for this kind of stuff?
Yes, I've seen something the size of my fist go down to a dime. Obviously, that takes time. I'm glad you brought up Remedy because I would get this question a lot. Just because she says it's bleeding sometimes, I can understand because it's pretty vascular. I would recommend our Soothe to start with because Remedy has the peppermint and eucalyptus in it, which can sting a little if we have raw or open or broken skin. Start with the Soothe. All of our salves have the same amount of CBD per 2 ounces, and that's the key ingredient to hopefully shrinking growth because the CBD will target the unhealthy cells, the possibly cancerous cells. That's what it does. It causes selective cell death. If there's CBD in there, great. We added the peppermint and eucalyptus into the remedy that we do recommend for skin issues or the skin growths because the peppermint eucalyptus, they also have anti-inflammation properties and are naturally antiseptic, antibacterial. But on the flip side, when we have something like this, I would start with Soothe first until we get that guy to shrink more and where it's not bleeding, like you said, that it's not dragging and causing possible trauma to where it's going to get infected. Let's start with Soothe. Obviously, an internal CBD, but I think it's in this group or one of our other groups. They took that long tube sock and they like split it and like they tied it around the shoulder blades, which that would
Oh,
be
cool.
a perfect candidate for that, just to kind of keep it off the ground because that location we don't want to make
It's
things
going to get
worse.
banged up.
Yeah.
Yeah, right on. I didn't realize that, but that makes sense. And the other awesome thing about Soothe is it has Manuka honey in it. So if there is anything that's open, it's going to chill it down and keep it from getting infected and all that good stuff. So cool.
Mhm.
That's an excellent trick, though. The whole tube sock thing. That's a great one.
Yes,
And then if this pup, yeah, dang, that's brilliant. And if this dog is 10, unfortunately, boxer pit bull cross, these guys have a propensity to make tumors. Definitely internal CBD. Where would you target the dose for this guy? So how many
oh,
milligrams would you shoot for, you think?
if they're 10 with this growth, I would start at a higher 35 to 50 milligrams a day. I would definitely use Heal, so that'd be about 1 ml throughout the day, and then Soothe to start, and then Remedy if we can get this guy to be a little bit smaller. But yeah, there is hope, and
Right on.
again, just because I see all that blood, I'm thinking stagnation, so some great herb to get everything flowing properly. Yeah, that's where I would start.
Right on. And so there's a formula we use called frankincense relieve soreness by Herbsmith. And while it's geared up to be a formula for joint discomfort and mobility issues, it also works on same idea. This is literally a blood stagnation tumor. Thankfully, it looks like it's benign, but that will help this thing move as well as assist with any discomfort that might be going on. Check that out. Let's see what else we got. Oh, here. So let's see. This Kimberly has a Shampoo puppy that's almost 5 months. Had parvo in October, 2 months post infection, but her stools are still ginormous. and they haven't really firmed up very well. Yeah, I think, Kimberly, if you start working on doing crock-pot diet, you're gonna find a really good help there because it's gonna be basically pre-digested. If you head over to the website, drruthroberts.com, and type in the original crock-pot diet, you'll see that come up. And then the other thing too is that this is a pup that's recovering from a pretty heavy immune assault. And so that's where, again, vitality would be a good option. You could certainly make a case to, it sounds like we're treating everything with two things, right? CBD and mushrooms, but they do so much. And then the other thing is too, is that the probiotics you've got are okay, but I would look at something like Saccharomyces boulardii because her gut just got thrashed. And so sometimes just adding in a broader spectrum probiotic, the gut is simply not ready for that. So cook real food, Saccharomyces boulardii, vitality, and then CBD, and then maybe just the heal product. Or where would you go with this one, Jenny?
I would just start with just the ease,
Right
honestly.
on. Your favorite? Okay.
Yeah, my favorite. And I would just, as they state, Shih Tzus can be so prone to food sensitivities. Do the Glacier Peak Wellness Test. It is a great baseline. I'm so happy you introduced me to that because I didn't know anything about it. I knew that we had it for humans, but not for animals. And it gives you really a great place to start when you're having issues with your dogs. Boom, it's going to tell you what they could be allergic or sensitive to in whether it be food or protein, veggies, in the air, environmental. It's amazing.
And that's the problem, is that so many of these guys just don't, because their guts got whacked at an early age, they start eating and then they end up developing sensitivities to what they've been eating. So it's crazy what can happen and what can go sideways on the gut so fast. And so somebody's asking about this stuff. I'm not sure what you're using, though, if you're using a probiotic or what have you, but yeah, post that in the comments. We'll see if we can help you out there. But I think, let's see if we can answer a couple more questions. You good with that? Or
Yeah, absolutely.
oh, cool. Oh man, does that not look like Nina?
I was gonna say, oh, Nina, and they're getting ready to amputate. Oh, yeah.
Yeah. So Angela, if you don't know Angela Ardolino, you need to go check her out, angelaardolino.com, the founder of CBD Dog Health and Micah Dog, and dear friend of mine, Jenny's boss and friend. But what started Angela down this path was her dog, Nina Doberman, who had osteosarcoma as well. And Angela was like, nope, not going there, not going to the chemo, the radiation, all of that. And what she was able to do was actually get Nina out 28 months, so over 2 years, which is great. Yeah, and it's doable. It's tough when you've got a metastasis. What I would say is that you're going to have to be really just perfect on what you're doing in terms of food, supplements, all of that. And I'm not denigrating your choice for IV treatments and chemo. Hopefully you're getting some IV supplementation as well. But what I would do is all of these things can work together. So turkey tail is a good one, but it's one of the few that's well studied. But in fact, mushrooms work in synergy better. So that's again where vitality, and this is a dog I would probably like start and get him up to almost a double dose. And then, yeah, and then also CBD at extremely high doses, work towards 50 milligrams a day pretty quickly. Angela was using THC products. And then again, food is going to be critical. So make it easy to digest. I'm not a raw feeder, in case you haven't guessed, but in this situation, this poor baby's gut is so compromised that if we try to throw raw food in there, we're going to create more problems than we solve. So cooked food, do a Glacier Peaks test, help to solve that leaky gut issue so that the immune system can stop responding to the fire there and then redirect its attention to where this cancer is. I would, and it looks like you're already working on cooked food, which is great. I think the nutrients are actually better absorbed in cooked versus raw. Turmeric is great. And the other thing is high doses of omega-3 fatty acids. Now, that you're going to have to modulate on the days where your dog is getting chemotherapy, although there are papers that say that it doesn't impact the efficacy of chemotherapy, as it turns out. God bless you, and I hope that, yeah.
I would make sure it's ketogenic. We don't want to feed the cancer with the carbs, so I wouldn't be putting potatoes or grains in your fresh food. And only feed once a day, fast. Literally starve that.
That's cute. Right on. And especially on the days around chemotherapy, on the human side, there's real clear evidence that fasting on the days around chemotherapy improve the efficacy of the medicine, which is fantastic, but it also decreases the side effects to the patients tremendously too. And with keto diet, I think you got to just see how that goes for your pet. Some of them do extremely well with it. It's a high fat diet. So if there's a history of pancreatitis, that's where something like a low methionine diet can be super helpful. There's a woman named Nalani Chilkov, who is a functional medicine oncologist for people. And she said the keto diet was tough for people to stay on because we are accustomed to eating carbs. But more important than that, the efficacy she saw, the results she saw for her patients was really incredible with low methionine diets. And we played around with developing one. It's interesting, when I was doing that, I saw papers where Mars Pet Healthcare was doing research on, is this causing harm for dogs or cats? So that tells me that they're looking at it too, because there is a great deal of efficacy out there. I think so.
Yeah, I would add in Breathe and add in pneumocare that you offer on your website as well.
Makes sense. Yeah, because we're up in the lungs already and the ribs.
Yeah, all these dogs with osteosarcoma, what are we doing? It's insane. I've had this conversation with so many clients, and I've had the conversation with myself. If I only knew now if I knew then what I know now. And we can't beat ourselves up over it because we're all here and learning and growing. And that's why we've made all these great communities. And we can't look back at the things that we've done wrong because we didn't know any better, because that was the standard of care back then. And we're, all of us, you and Angela and you, creating a whole army of holistic pet health coaches. Like, we're rewriting the script, and we're letting pet parents take their dog and cat and rabbits and every other pet we have out there, their care, into their own hands, instead of just listening to the veterinarian. And I'm grateful for you and Angela, because you guys are really just leading the charge, and you're creating people to spread your message even further. And I just think we're going to take over the world one day. So
that's the game plan. But that's the sad truth, is that part of the reason I created this program is because the crisis of access to care is horrible right now. And Mars Healthcare, who owns 40% of veterinary medicine in the US and UK, commissioned a study to understand why this crisis has arrived and what's it going to look like in the future. And what they found is that the estimates are that by 2030, there will be a shortage of 24,000 veterinarians. And literally, I came across this study from the American Animal Hospital Association, and the title of the article was, "If you think it's bad now, just wait." And this is frightening. So y'all are there, you're struggling to find answers, you're struggling to get support, and you're struggling to be able to afford to do these things. This is why the coaches are here. So if you haven't done it, head over to drruthroberts.com and click on, and let me see if actually I can do this really fast. Click on our consultation page, go look at the coaches that can help you work through the problems that your pets are experiencing, realize that if your dog has had diarrhea for 2 years, it's not going to take 2 days for it to go away. Be patient, be willing to start with a plan to figure out what's working, what's not working, and to pivot. Because that's what all of this is about. Personalized medicine is we don't have the magic insight as to what is going to work for you, for your dog. So sometimes it's a little bit of trial and error. So that's what we got for you. Happy holidays to everybody. We'll have a special end of the year broadcast next week. We'll get to unveil a really cool, groovy song, and that's what we know.
Awesome. Thank you so much,
Thank
Dr.
you.
Ruth.
It is my pleasure, Jenny.